Hi, good morning, Mr. Kirill. Before we start, I want to make sure, can you hear and see me all right?
Good morning, doctor. Yeah, I can hear you and see you fine.
Great. What brings you in to see me?
So I just needed a refill on my insulin because I just found out I'm running really low. So I was kind of worried if I would be able to get a refill during COVID.
Yeah, absolutely. I can see how that'd be pretty worrisome. Definitely a lot to be stressed out about right now. It's not a problem at all. I can actually refill your prescription via my computer right here. Are you still picking it up at your pharmacy?
Actually, yeah, my pharmacy just started filling prescriptions through the mail. So it's great to be able to get my meds without having to leave the home.
Yeah, that's really great. Definitely very important to be able to stay safe when getting your meds and to consistently take our medications, especially during everything that's going on right now, so that we are able to stay healthy. I'd also recommend in the future you can always reach out to your pharmacy about a week ahead of time if you notice you're running low, and they can help you, or they can get in contact with me if they need to have anything that I need to help them with. Anything else I can take care of for you today, Mr. Carrillo?
Um, Nothing today. I'm just really glad that I was able to see you and speak with you after so long.
Yeah, it has definitely been a while. Really great to see you as well, albeit virtually. I want to encourage you. Always feel free to call the clinic or send me or any of the clinic staff an email. Reach out through the patient portal if there's anything you need or want to talk about. With the virtual environment, right now it's even more important we stay in communication so that we can be on the same page. When we can always set up a virtual visit like this, like we just had, or we can make arrangements to meet in person if that's necessary as well. Stay in touch, Mr. Creel.
I will. Thank you, doctor.
Great, thank you. Hello, everyone. I'm Hunter Vandola. I'm a first-year medical student at the Georgetown University School of Medicine. I'm joined by my colleague Tom Creel, who's also a first-year student at Georgetown. We're going to talk a little bit about medication adherence and refills during COVID-19. So there's many methods of refilling medications and requesting a refill. One can always request a refill through a patient portal or patient interface system if that's accessible to you. These are very specific to different health systems, different physician or provider practices. So we can't talk too much about the specifics, but each system has an own unique way of making a refill request and staying in communication with a provider. They're often very fast. Another way you can always stay in communication with your physician, especially for refill requests, is through a simple phone call. You can make a request directly through the phone or speak with a member of the clinic about any issues you might be having. Currently, during the COVID-19 pandemic, you're able to get a 90-day supply of most medications if you're covered by Medicare, Medicaid, and most other commercial insurance plans. So you can make a request for a 90-day supply so that you can reduce the frequency of needing refills. And additionally, many pharmacies are now offering prescriptions via the mail, delivered directly to your home. You can call your pharmacy directly to speak with them about how they can set up home delivery. And as we mentioned in the video, you can speak to them 1 week ahead of time if you notice you're running low on medications. And I'm going to turn it over to my colleague, Tom, who's going to talk a little bit more about this.
So, although so many things in our lives have changed as a result of the COVID-19 pandemic, it is incredibly important that one thing that does not change is the way we take our medications. So, if you find you are having trouble obtaining a refill or you need a refill for your prescription, please feel free to reach out to your physicians via the patient portal, as Hunter mentioned, or even a simple phone call or an email to which their physician or his or her office can reply to and get back to you to help you with your issue. Actually, the Center for Disease Control recommends keeping an extra supply of medication, preferably a 14-day supply, in the case that you would need to quarantine and isolate yourself, so that even though you can't get out of the house, you'll still have a ready supply of medication available. So thank you so much for your time. Stay safe and stay healthy.